Welcome back to Cheddar's Opening Bell. Medical technology supports doctors and nurses on the front lines of the fight against COVID-19, and it's also the potential path forward for widespread testing in the U.S. Joining me now is Scott Whitaker, the CEO of the Advanced Medical Technology Association. Scott, thanks so much for joining me. Your association is heavily involved in testing, and there are growing calls across government and businesses that widespread testing is the key to controlling the outbreak and reopening the economy. What would it take to make this widespread testing happen?
Yeah, thanks for having me on, Kristen. It's good to be with you. It's a very complicated business, and we have done a lot over the course of the past few weeks to scale up to the level that we are today. March 12th was the first diagnostic test that was approved by the FDA, and today we've already tested about 3 million people across the nation. We're on track to try to get by the end of this month to 20 or 25 million people tested. And then as we get into the summer months, we can scale up even more dramatically. But it's a complicated process. The FDA has been great to work with to help us scale up to the levels we are now, but there's a lot more work needs to be done to get it broadly across the United States.
And antibody tests, also, we are learning a huge part of the reopening of the workforce. What are the biggest challenges making that widely available?
So that's a longer time period that's going to take to get the serology test up and available. The diagnostics piece that we've been working on already is now scaled up, and now it's just a matter of scaling it to a larger number. Right now, we're working on developing the basics of the serology test. And once we have that, I think in the next couple of weeks, we'll have a better sense of how quickly we can scale up. But Kristen, there are two pieces to this, right? There's the part that we do, which is to create the test, create the testing mechanisms, and the machines that run those tests. The second part of it is making sure that doctors can interpret the results and determine what type of immunity people have and whether it's sufficient enough to prevent the disease from spreading further. And so there's more work we have to do together with the government, with private docs and hospitals and labs to make sure this is accurate and helps us get where we need to be.
And I know that you're involved with the technology that is helping these healthcare professionals on the front lines. How do
Right.
you make sure that they have the supplies that they need when we've heard time and time again that it's challenging in some areas just to get a mask?
Yeah, it's been a real challenge. You can never fully prepare for a novel virus that hits a country like ours. And so, to some degree, it was hard for us to immediately scale up to meet the demand. We have turned this around, I think, in record time. We've now got hundreds of millions of personal protective equipment that's available for docs and nurses in hospital settings. We also do sterilization. So, one of the things we focused on over the course of the past couple of weeks is creating new sterilization methods that can be used to sterilize masks and other hospital gowns and other equipment that already has been used and get that back into the hospital setting. And so that's been much of the work we've done as well. I'll also say, Kristen, on the ventilator side, which early in this disease progression was a major concern, tremendous concerns there were going to be mass shortages across the United States. This is an industry that manufactures those and has scaled up tremendously. We're about 10 times the number of ventilators we manufacture per week than we were when this crisis hit us. And so it's really encouraging. And I think the net result of that is we have more in the stockpile if this continues to spread. And the immediate needs, as you've seen in New York, have been met by this industry. And so we were pleased to be a part of that result and glad that we are where we are. We're not resting, of course. There's more to come. It could spread across the nation, and we'll continue to build these machines and have capacity necessary to treat patients with COVID-19.
Ventilators and protective gear, some of the most in demand products right now. How do you think this pandemic is going to change just the amount of medical supplies and equipment going forward and the way that we source this too?
Right. So it's a great question, and it's hard to know today exactly how it will impact it. What I've said to government officials over the course of the past few weeks is the one lesson we've learned is that private industry can manufacture and scale up early before a crisis hits. And if Congress and the administration are willing to spend the money necessary to stockpile all of this material, we can be better prepared next time around. So our recommendation is once we get through this, let's make sure the stockpile is not only full but overflowing with all the personal protective equipment, medical supplies, and everything else that might be needed during the next crisis. And so we're committed to doing that. We have the capacity to do that. And honestly, the administration has been very responsive to our request in this area.
Scott, how quickly can that supply chain, the amount of supply that we have in the system, be ramped up in case, in the unfortunate circumstance that we do see another wave of this come in the winter of next year?
Yeah, it depends on the category. And the simple personal protective equipment, very, very quickly. We can do it in a matter of days. With ventilators, it takes us more like weeks to a month. And then when you're dealing with diagnostic tests, depending on the virus, it can take weeks or months to do that as well. So, in all three categories, we've got the systems in place to do that now, which is encouraging, I think, across the board. It's a matter of understanding the scale and then the allocation system as well to know where these products need to get to meet the urgent demand. And so it's why a public private partnership is so critically important in order to address a crisis like this. Working hand in glove with the administration is so important. We've been frankly pleased with the interactions we've had with them, specifically the FDA, who has been remarkable in their ability to approve a new technology and move a technology to market along with us. And it's been tremendous. I was talking to a CEO a couple days ago who does a diagnostic test, one of the first ones that came on the market. He said typically the regulatory process at FDA would take him about a week or so, or a year or so to get through the process. And he did it in less than a week, along with the work of the FDA. So that just gives you a sense of what government and private industry can do together to meet the demand. And so we've been encouraged by that. Of course, there's a lot more work to do.
Scott, thanks so much for joining me, and we wish you the best of luck. That is Scott Whitaker, the CEO of the Advanced Medical Technology Association.
Good to be with you. Thanks.